What if I told you on average 55% of terminally ill patients die in pain after thousands of dollars spent in hospital bills? Physician-assisted suicide can be a beneficial alternative to hospice care for terminally ill patients, their loved ones, but also programs such as Medicare. As a certified nurse assistant, I have witnessed the negative effects of hospice care in various ways. The idea of hospice care may seem far off in our future as we are only college students, but it still has the ability to be part of our future, whether it's ours or our loved ones, which is why it's such an important topic. Hospice care is extremely expensive, and there is a less expensive alternative, which is physician-assisted suicide, that gives terminally ill patients a choice to go in peace. Hospice care, also known as end-of-life care, is provided to those who have a terminal illness and are expected to only live for 6 months or less. The problem is that in these last few months, the cost of hospice care is high, along with the suffering the patient can endure. According to Kaiser Health News, the cost of hospice care can be upward of $10,000 per month. About 85.5% of hospice care is paid for by the Medicare Hospice Benefit, which is a government-sponsored program. Hospice care covered by Medicare pays for all prescription drugs, over-the-counter medications, medical equipment and supplies, labs and other tests related to comfort and management of the terminal illness, as designed by the hospice team. There is a solution. A cheaper alternative for hospice care expenses is physician-assisted suicide, which is much like euthanasia. However, euthanasia is not legal in any part of the United States. Physician-assisted suicide is when the doctor prescribes a patient with a lethal dose of drugs that they'll administer themselves when they feel the most comfortable, while euthanasia is when the doctor administers the lethal dose of drugs directly. According to an article about the economic aspects of euthanasia from Life Resources Charitable Trust, the Right to Die advocates claim that the elderly and those with disabilities fear becoming a financial burden on their loved ones and would rather choose death. They state that next to pain and suffering, that is the second most important reason people are pro-choice on this topic. In comparison to the thousands of dollars spent for hospice care, the drugs used for physician-assisted suicide amounts to approximately $35, but a difference from state to state. This is the cost in Oregon. If this option becomes more available for terminally ill patients, not only is the cost for families and the government less, but it also ends suffering, retains dignity, and makes it so the grief of families is easier to handle. Even though cost is a major factor in promoting the legalization of physician-assisted suicide, the end of suffering plays a large role in why it should be legalized throughout the country. In 2014, a 29-year-old Brittany Maynard was diagnosed with terminal brain cancer and a prognosis of 6 months to live, in which she would endure pain and suffering. You may have heard her story as she was on the cover of People magazine and is a big spokesperson for this issue. She made the move from the San Francisco Bay Area to Oregon, which is one of the states that promote the Death with Dignity movement. She then became part of the Compassionate Choices organization to promote the aid of people who have terminal illnesses to die on their own terms. On November 1st, 2014, she made her own decision to end her life with physician-assisted suicide. We can help advocate terminally ill patients' right to make their own life-ending decisions. Support the Death with Dignity statute for states who have yet to pass the Right to Die movement. Go on to deathwithdignity.org and sign up to be a supporter of the cause and help your home state pass this statute. There are various ways you can contribute on the site, from just joining the movement or specifically taking action. Currently, the states that have the Death with Dignity statute include Oregon, Washington, California, Vermont, and recently Colorado, which is where I'm from, has passed this movement. According to Death with Dignity, you could be part of the 7 out of 10 Americans who support freedom of terminally ill patients to make their own end-of-life decisions. Thank you.